clinical partner of UniHealth with access to an accredited diagnostic unit in London. Which is your specific and indispensable role in the UniHealth project?
So as UCLH, we are the clinical leads on Work Package 3, and we are uniquely placed because we have access to diagnostic samples that come in through for routine testing to our diagnostic lab. And we have access to these real-world samples to do the clinical evaluation of new products, such as QC-DAMP, in this case for UniHealth, and to do a clinical evaluation with real-world samples and see how this technology and new assays actually work with real human samples.
So please take us along the new tool clinical evaluation developed during UniHealth. How will you screen the patients? What characteristics, if any? What are you looking for?
So as mentioned, these samples that we get are already for testing for the specific viruses. In this case, it will be influenza and SARS-CoV-2. And because they are pre-screened through the diagnostic protocol, we already have this information to then use these relevant samples for a clinical evaluation. And we have all the background information associated with that.
So, will you evaluate also the uptake of the tools from healthcare providers as well, and how?
Not specifically, because we are not evaluating the uptake of these tools within this study. However, we are involved in some surveys with healthcare professionals to see how these new tools and assays could be used in the specific roles and what their views are and what their comments are on what's important for these tools.
Thank you so much.
Pleasure.